Producer Tom says, we're back, rocking and rolling. First of all, good karma. Thanks for calling in about the Stay Well Center. We'll take calls. We have a caller online, one waiting. Sorry to keep you holding during the commercial. Michael Regan, how can I help you?
Yeah, hi. I'm calling in to say that if you say something, you keep your word. I had a problem. I went to the doctor's office just for a physical, which I usually don't have to pay anything.
Okay.
And after this was last year in November. And after that, I received a bill the end of November of $125. So what I did, I went down to talk to Mike about this problem, and he told me he would solve it for me. And he did. It might take a couple of months for him to get it straightened out, but I received my money back.
Caller, is it okay if you just tell my listeners your first name, not your last name or anything? Don't be shy.
Bertha.
Okay. I think I remember this situation. First of all, you are the most beautiful woman. I still remember you and your sister. I'm enrolling you in your condo up over on the hill off Schrafft's Drive, correct?
Mm-hmm.
Heck yes, I know who you are. So the scenario is, it's a snowy morning. I don't know how you trekked out in that snowstorm. I'm shoveling, double backing over my plow guys because I trust no one. And so I'm out there, and here you are, all in your beauty. You come up with a bill, and I'm not going to knock any doctors. I love doctors. We'd be all sick without them. So anyway, you present me with a bill. I remember the bill. It was about $100 and something.
Mm-hmm.
So you said to me, your exact words were, well, I'm going to go ahead and pay it because I don't want my credit hurt.
Right. And I have to keep up with my credit because I have to take care of myself.
You care, so, right. So you said to me, no names for you. I'm Mrs. So-and-so.
Mm-hmm.
I say, okay, B, let me say something. And I asked you the scenario, and you said, well, yeah, I just went for a regular checkup.
Mm-hmm.
And I said, hell to the no. We are not going to pay this bill if you didn't ask your insurance agent a question. You would have gotten taken, or a little meaner word, screwed for $150.
Right.
And you're so worried about the credit. Me, all I care about is fighting for the people. Sure, I work for the carriers. My job is to work for the insurance carriers. But my job is to be a good agent. I remember you leaving the building, and I said to you, have a great day, God bless, and don't worry, I'll get this paid. The true scenario is they coded it with a wrong code. Simple. And I talk about this at least once a show. 5 out of 10 people are going to just pay the bill because they think they owe the bill.
Right.
So you and I fought it. We wrote our letters, and I have to thank you for calling in the show. That was really nice of you. I am a man of my word. I'm honored to have you as a client. Thank you very much for your business, and I sincerely appreciate you calling in.
Okay, Mike. Thank you.
Have a great day, Bertha.
Bye.
Appreciate it. All right, so the scenario is the doctor's office has to code things. You might run into this, Christine. It's got to be coded with a V code. And the doctor's office knows what they're doing. If they can slip 5 or 6 by, they're going to get paid. And you don't necessarily know the scenario. You just know that you're supposed to get a preventative visit at the doctor. I'm glad we won. I like winning. All right, enough about me. And please, if you see my head getting big, pop it. Please don't let that happen. All right, take it away. Stay Well Center. How can you help my listeners?
Well, I think that's very interesting what your caller was speaking about, is that medicine has gotten complicated. And even though we have board-certified doctors at our organization, it seems they need some sort of a degree as well in coding and billing.
A tutorial.
Yeah, so that's a challenge. I mean, we try to simplify things at Stay Well for patients and for staff, and try to keep that complication out of the middle for them. I mean, our goal is to make certain that services are accessible. So what does that mean? We accept all Medicaid. We are down the state of Connecticut to one Medicaid plan now, which is nice. Again, simplifying health care.
Nice, slowly. This is important.
I have so
knowledge.
much to say.
I know,
What's going on?
They've got to comprehend all this. All right.
We also work with all of the Medicare plans, and we accept patients who are uninsured. So oftentimes, lack of insurance is a barrier and also makes things more complicated. but we try to keep it simple. We have a sliding fee scale, and based on what people can afford, can work with you. Because the most important thing is getting people in for the care that they need. You can't delay things and expect it's going to get any better.
No,
it just makes it worse.
You have to be proactive.
Right.
You need to take care of yourself. People out there listening, you heard Christine. You don't need to have the Cadillac United Healthcare plan or the Century Preferred Anthem plan. Right. They care about people first and foremost. Do not be afraid. Go get yourself taken care of.
Absolutely.
You take uninsured.
Absolutely.
And what do you just do, a fee for service?
Right.
All right. Explain that process nice and slowly.
In fact, in 2011, our uninsured rate increased to 19% of the overall patients we've seen. So, and we were prepared for this. So when we purchased the 80 Phoenix Avenue location in 2006, we wanted to have a center, and actually our name of our campaign was Opening New Doors to Community Health.
Love it.
Because we knew that there were going to be struggles ahead. That's the way our economic cycles work, right?
Right. Cyclical, about 25 to 26 years.
So folks were going to find themselves, and sort of what we were talking about earlier with the situation of housing, folks who had been insured forever would now find themselves without insurance and in a whole new situation when they wanted to access healthcare services. And we really believe that Waterbury deserved a health center, a place to receive care that where they felt they were treated with dignity, where regardless of their insurance status, the building wasn't falling apart or
decrepit.
Our center's beautiful.
It certainly is.
Thank you. And people can just begin to have a sense of wellness as they walk in the door. So in terms of what do we do if you're uninsured, there is a requirement by the federal government that one has to prove their income. So all the information is held confidentially, but there needs to be...
And that's a HIPAA, obviously.
Correct.
Health Insurance, Portability, and Accountability Act. We are not going to steal your identity. We're not. This is confidential. We care about you, but we're governed by the state. So,
absolutely.
All right, keep going.
And the federal government as well. So even though, I always say that the federal government from the Health Resources Service Administration, they may only give us 6% of our annual budget, but they're really keeping track of 100% of what we're doing.
Yeah, the watchdog.
And that's important because people should know, and taxpayers, Medicare, Medicaid, they're public dollars. And, even though, we work for those funds, we provide a service and then bill for that service, we all deserve to know that those dollars are being well spent and that the care that we're giving people is quality care, the outcomes are there.
Right.
So, again, you come in, you're uninsured, you provide that proof of income. Well, what does that look like? It can be a pay stub. It can be a letter from the person who you babysit for or you clean their home. And we do have folks who, quite honestly, have no source of income. Unfortunately, we know what the economic situation is in Waterbury right now. And so we accept a letter from the person who is putting the roof over your head and feeding you. Based on that, we develop a sliding fee. So based on the sliding fee schedule that's set, depending on the service that you're receiving. And we work with you again in getting that paid. So sometimes you may have the $25 fee, and sometimes you may have a portion of that.
For a copay?
For the whatever the fee is that's been assigned to
someone. That particular bracket of income level.
Correct. Again...
And do you follow the federal poverty guidelines?
We do.
That's what I handed you here. Sure.
Right. And what we do is every year our board of directors will approve the sliding fee schedule based on costs, what it's going to cost us to provide that service. And one of the things that's exciting is that we're different from most nonprofits. We are a consumer majority board. So your board of directors at Stay-Well Health Center that is setting and voting on our fee schedule, more than 51% of those individuals are consumers. In fact, we have an individual who was previously homeless. We have individuals who are uninsured, those who are on Medicaid. So these are individuals, board members, who understand what it's like to face the struggles that get in our way from keeping ourselves healthy, from getting the care that our families need. And so they're really in the best position and have that firsthand knowledge to help us make these policy decisions.
That's what we're talking about here, firsthand knowledge. Not some spoiled brat from Cheshire, Michael Regan, who grew up with a silver spoon in his mouth, who sits at a boardroom table and says, yeah, I understand. I don't have a clue of what that homeless person's...
Right.
I don't understand.
Right.
And I wish more people were like you and a do-gooder and a helper. And it's just such a pleasure to talk to you. We rehearsed that, by the way.
You.
Where's the little catch, that awesome catchy line, by the way?
There.
She is saying to me,
I stole from the Constitution.
51% is run by the people for the people.
That's right.
It's like, yeah. All right, for those of you that don't get all excited like me, I completely understand that. But how many of you know these services are out there? Constantly, my seniors are saying, I don't have dental with my Medicare product. Can they use the Stay-Well?
Absolutely.
All right, listen up, everyone. Go ahead, Christine.
So I do get excited about oral health care. And because for so long, oral health care was the forgotten component of our physical well-being and our overall health and wellness. And let's face it, if people are having tooth pain, they can't go to work, they can't go to school, you're not eating properly, and it's really just that place to introduce infection and bacteria and gross into the body. So, and that old saying, you only get 2 sets and you're done. So there's no repairing once that damage really starts to set in. So Stay-Well Health Center really has committed itself as being the safety net provider for dental care in Waterbury. We have some great partners. St. Mary's Dental Center does excellent work with us as well.
Give them a plug. They're good people.
Yeah, wonderful. And I think together we've really, in the past 8 years, provided leadership for the Waterbury Oral Health Collaborative and are getting more individuals and systems within the community to pay attention. Right. So we have, I think we're up to 14 dental chairs within our agency. It's hard to track. We are in every single public school, high school and middle schools as well, providing cleanings and sealants for kids.
So parents out there that got let go because there was an early dismissal today and you're listening, your child has access to these programs.
Right.
And we are probably going to have Christine on every 3 or 4 months because let me just say how great Ruthie Suertes is. I speak a little Spanish. I'm a total hack, but I can speak a little. So once in a while, I see a situation, and it doesn't even have to be with the Hispanics. It could be the Portuguese, the Italians, the Afro-Americans, the whites, whatever race. They need help. I go into the home, I sell insurance, or I'm at the business, just got a nice large manufacturing company, and I see an Albanian family. They have Social Security numbers, they're working hard, but they're only making $9 or $10 an hour on the line. They're welders or they're bottle pickers, whatever it is. They have children. I call my friend Ruthie. I say, hola, ¿cómo estás? She says, bien, Miguel. And I say, I need your help getting people husky. She says, what can I do? She makes an appointment with the people. I know her extension by heart, 3053. I mean, what a lovely person. And Maria was good.
I'm so blessed.
Yeah,
I'm personally blessed to have Ruthie in my life. But our agency is really blessed with people like Ruthie.
Caring.
Who, right, I mean, they...
Go over a typical scenario, like a day for you. I mean, it's just, how many people you're helping? Hundreds.
Yeah, we have, this year, we just submitted, just finalized our data for 2011, over 80,000 visits and over 20,000 unduplicated people. That's a fifth of the city. So,
right.
But we do have people who care. And I think the difference is a lot of our staff obviously are working, are raising their families in the community. So the people they're helping, they're their neighbors, they're the parents of the kids their children play with.
They're people from their parish or something.
So absolutely. And I do think that there's just a different sense of commitment and feeling around what we're doing.
I think you are doing a fantastic job. I'm actually personal friends with Don Thompson. I've had a beer at his house before. He had a little fundraiser for Salim Najm, and we were there. And he said, I'm really reaching out to the community because I want to. And I know that he lobbies time after time after time for the funds, which it's always a struggle.
Well, we educate.
Yeah,
we
please.
Don't lobby.
Please. Okay, go ahead. Discuss that. How do you go about having the Stay Well facility?
Well, I think it's important that we be a voice for our patients and we make certain that the services that they need are accessible to them. So we do receive grant funds from the state of Connecticut, from local foundations, the United Way here in Waterbury.
Kristen Jacoby, what a phenomenal woman she is.
Yeah, and we appreciate her leadership in being able to look at how funds should be spent effectively. We take that very seriously. When Don and I tell the story, I mean, I've been at Stay Well for 16 years.
Nice.
Which is crazy. But
you must have started in high school then. Oh, wait.
But when I started, we counted the number of visits we had, and those were our outcomes. But medicine has changed, and so it's not enough just to be seeing a patient. We want to make certain, okay, so you had a 15-minute visit. What was accomplished? Was that patient reminded about the preventive service that they need to get completed? Was that patient in 3 months followed up to see if their chronic disease is actually doing better and they're feeling healthier?
Right.
So that's the direction of healthcare, and that's really the United Ways and others are really expecting that level of accountability, as should the people who are contributing. Expect that their donations are really being invested wisely. That's
important to touch on because sometimes it's where's the money going? You clearly account for where the money's going.
We do.
You're at every function. You are in the community, like you said. You're not just sitting back taking in money. I know several of my clients that have received care from you, and it was psychological care. Mm-hmm. You do that as well, I heard, for mental health.
Right. We do have mental health services. Unfortunately, people face both physical as well as mental health challenges.
Right.
And oftentimes the two are intertwined with one another. And we'll see people who are struggling with some sort of chronic disease, maybe develop some depression around the limitations that they're facing or that they're, trying to overcome. So the two are integrated in terms of we're going to treat the whole person. And, again, taking seriously that you want to help a person reach their optimal health.
And you do the Husky as well as Charter Oak, correct?
Right.
I believe you're running both of those programs.
We help people with application assistance to enroll in either one of those programs. And some of those services, we help people with that process regardless of whether or not they come to Stay Well Health Center for their care.
No, that's my whole point when I talk to people. You're getting a turnkey agency here.
Right.
This is going to be your doctor's office, your dental office, and your paperwork assistance. I really, if you're listening out there, don't want you to just use the Stay Well Center to have your Charter Oak or your Husky application filled out and not use them. That's not my intention.
Right.
My intention is to give you a reliable, clean, A-rated. By the way, your ratings are fantastic with the state. And that's what's important to me because my name is on the building, so it's my butt on the line if I send you somewhere wrong. Don walked me around 1309, the dental clinic.
Yes.
Gorgeous. It's clean. You've done a great job with the Shakers building at 1302.
Yes.
And he's hands-on, by the way. When I was joking around about Bob Burns at the Mattituck Museum, Don's actually in there cleaning, taking stuff to the dumpster.
Absolutely. No one's off
Christine,
the hook.
I'm sure you roll your sleeves up and get dirty. I mean, you don't look that today, but yeah, you're really a community-based organization. That's why I have you as a guest today. I want people to know that regardless what you have, Aetna, Anthem, United Healthcare, Connecticut, they will take you as a doctor. Dr. Carl Schiano, I can talk about it now because I got approval in the car. He abandoned his practice. I had callers calling in. By the way, you got to pat Regan on the back for I called this before it hit the paper, months before it hit the paper. So a good friend of mine, most beautiful Portuguese woman you've ever seen, is a friend, and she told me, look, I see some trouble here. We're having trouble getting an appointment. All of a sudden, that woman and about 6 other clients, friends of mine and clients in Naugatuck were saying, yeah, and you heard if you listened to the show on the woman in Naugatuck, we couldn't find Dr. Schiano. So my philosophy was I told every one of the callers that called in, where do I go? Go to the Staywell Center. One, you accept Medicare assignment, correct?
Correct.
That is the most important part of this show that you must understand. A Medicare supplement and a Medicare Advantage and Medicare in general. The key is the doctor has to take Medicare assignment. Secondly, when you go to this facility, you'll have a plethora of choices. What are the services that you offer? I know, to tell you the truth, I think the most beautiful benefit you offer, because it actually gives birth to something, is the assistance with the pregnant women.
Yes.
Now, again, like the homeless, nobody wakes up and says, let's get pregnant today. Abstinence, that's great. Good for you if you can abstain. The younger generation is influenced a lot by television and violence and not Leave It to Beaver families. Mom, dad sit down every night having dinner, go to church on Sunday. Perfect scenario. 1 sip of wine a week. There are situations out there that a 16 or 15 or 17-year-old girl doesn't have a strong family group. She gets pregnant. Well, we just shouldn't turn our back on her and say you're on your own in life. First of all, give her credit for not killing the baby. Okay? She comes to the Staywell Center, and how do you help them?
Well, we do provide prenatal services, and the services we provide starts from the point of taking a pregnancy test. Again, it doesn't matter if someone's uninsured or insured.
Correct.
We will help them get the insurance to cover the pregnancy. And in that situation that you're talking about, we do have case managers who will work with that adolescent to be able to figure out what her supports are.
Or that adult, if for this situation.
Absolutely. But there are times when teens need help in disclosing the information to their family. Again, we're interested in supporting the health and wellness and improving that birth outcome, or making certain that birth outcome is going to be healthy. Because you don't want for someone to be hiding the pregnancy, not taking care of themselves in the way that they need to be during the pregnancy, so that we can have the the proper birth outcome. Because let's face it, when the infant's born, and in our community, now we're going to start to look at is this a healthy child? Is this child going to be ready to learn when the child goes to school and so forth? So we are committed to making certain the best outcome possible happens.
And
but Mike, you were
Please.
talking before about Medicare.
Please.
And helping the seniors in our community. And a couple of things. One is that's important is that this is Colon Cancer Awareness Month, the month of March. That we'll be in tomorrow.
Colon?
And colon cancer.
Colon cancer.
Correct. So it's really important for me to get a plug-in as a
Please
reminder.
take your time.
To remind everyone that it's important to have a colonoscopy, and that we have some services available to help triage people to that service and help them to navigate the way. Again, it's sort of, especially if it's for the first time, it's something new that someone's going through. Maybe you don't know where to go, you don't know what the prep's like, and that sort of thing. Under the leadership of the Connecticut Community Foundation here in Waterbury.
With Ingrid Manning?
Yes.
Oh, what a lovely woman.
And Carol O'Donnell.
Sure.
There's been some new focus on seniors in our community and really looking at...
A radio show, sure.
Yes, right. And really needing to pay attention to what services do we have in place, what are the needs in our community. So we are working with that, with the newly founded collaborative, and actually the foundation has provided us with some funding to be able to address senior health care services.
Okay, so this is the perfect opportunity. Go ahead and tell us what you have for them.
We've hired a geriatrician,
okay.
So a bilingual provider who has expertise in healthcare issues related to seniors.
Okay.
We also have a senior outreach worker who is doing some duplicative outreach. So, number one, reaching out into the community to let folks know that we're here to serve seniors, to get them in for care, but also learning about some of the resources in the community so that as seniors are seeing our doctor and maybe someone discloses, gee, I missed my appointment last month because I didn't have transportation, that we have the knowledge that's needed to be able to solve that for that person.
And you work with the Agency on Aging for the transportation. Where do you get that?
There's a couple of different resources. If they are on Medicaid as a secondary, there's some transportation that's newly available for them. Several of the communities have the van.
Nice.
And available. So there are a few resources available. We sometimes will give out bus passes if someone can ambulate well enough to use the bus and they're comfortable doing so.
Right, the ambulatory, sure.
So again, we recognize that there's all sorts of barriers to healthcare that aren't always medically based.
Right.
And our approach is to overcome those barriers. My favorite story is, in terms of solution, is a few years ago we had a prenatal patient who was not gaining enough weight during her pregnancy, and we became concerned about the health and well-being of the unborn child and trying to figure this out. And ultimately, we figured out that she didn't have a working refrigerator. So in terms of having being able to have enough food readily accessible. For those who've been pregnant, you're eating 15 times a day. You need to have a working refrigerator.
Right.
So, again, trying to figure out those barriers and come up with solutions. And we rely on our partners in the community to do so. We're not doing this alone. That's for darn sure.
Well, that's why you're on the air, to plug them, to give them a little credit. Mm-hmm. We're going to plug ourselves. Producer Nick, want to do it after the commercial break or now? All right, we're going to take our second commercial break, plug the sponsors. We'll get back, and then we'll wrap it up. Thanks for listening.